Welcome back to the OncoAlert Weekly Roundup, where we unpack the week's biggest stories in cancer care and research. I'm your host, Gil Morgan, and today we are taking you through some of the major developments across tumor types this week with one major overarching message. Precision, personalization, and patient-centered care are driving the next era of oncology. Reminding you that these are just some of our picks, but for a deeper look, we invite you to subscribe to our newsletter at www.oncoalert360.com or through the link below. That's www.oncoalert360.com. So let's begin with geriatric oncology. Older adults with cancer present a growing and vulnerable population. A landmark review in CA, a cancer journal for clinicians, highlights the power of geriatric assessment guided management, a tool that evaluates not just tumors, but the whole person. Tailoring care based on functional status, comorbidities, and even caregiver needs reduces toxicity, improves quality of life, and enhances communication. Yet, despite proven benefits, it's underused. Expanding access through screening tools, workforce engagement, and telehealth is crucial to delivering equitable, high-quality care to our older patients. Now on to GU cancers. In prostate cancer, the final results of the TALAPRO-2 trial are practice-changing. Talazoparib combined with enzalutamide significantly improve overall survival in men with HRR-deficient metastatic castration-resistant prostate cancer, especially those with BRCA1/2 mutations. This establishes a new standard of care for this molecularly defined high-risk group. In kidney cancer, a review in Nature Reviews Urology spotlights the complex world of non-clear cell renal cell carcinoma. These rare subtypes lack standardized treatment approaches and show variable responses to systemic therapy. The path forward lies in deeper molecular profiling and subtype-specific strategies to deliver precision medicine where one-size-fits-all simply doesn't work. And in breast cancer, we have encouraging news from the positive trial. Women with early hormone receptor positive breast cancer who paused endocrine therapy to become pregnant were able to safely breastfeed with no short-term increase in recurrence. This is empowering data that reassures young survivors about fertility and motherhood after cancer. Lung cancer in never smokers, often a clinical puzzle, got clearer thanks to the Sherlock Lung study. It shows that lung cancer in these patients is driven not by secondhand smoke, but by geographic and environmental factors like air pollution, which shape distinct mutational signatures. These findings deepen our understanding and highlight the role of environmental justice in cancer prevention. Next, we move on to brain metastases. A sweeping single-cell atlas revealed 5 distinct ecotypes of brain metastases across tumor types. These ecotypes share malignant traits like chromosomal instability and neural-like programs, and they exist in highly immunosuppressive environments. This work opens the door to targeting shared vulnerabilities across other distinct cancers. Speaking of immune response, mismatch repair deficient cancers, those with microsatellite instability, are highly immunogenic and responsive to checkpoint inhibitors, but resistance remains a key hurdle. Ongoing research is now focused on better biomarkers and diagnostic strategies to predict and sustain ICI response in these patients. And that brings us to the gut microbiome. In a growing number of cancers, gut health may be a secret weapon. Studies are exploring how diet, probiotics, or even fecal transplants can enhance responses in immunotherapy. Early results are promising, particularly in melanoma, RCC, and non-small cell lung cancer. But we need robust trials before this can enter routine care. This week, GI cancers also saw a pivotal update. A meta-analysis showed that omitting 5-FU bolus from chemotherapy regimens doesn't harm survival, but does reduce serious blood-related toxicities. This could refine how we deliver chemo safely and effectively in GI cancers. And finally, hepatobiliary cancers. The ACCORD trial found that adding immunotherapy and chemoradiation post-surgery for extrahepatic cholangiocarcinoma and gallbladder cancer significantly improves survival compared to observation. With tolerable toxicity, this regimen may soon become a foundation for adjuvant therapy in those aggressive cancers. So what ties it all together? Whether it's genomics, aging, the microbiome, or local environment, personalization is key. We're shifting from broad categories to individualized blueprints where biology, patient preference, and smarter strategies all come together to deliver better outcomes. And there you have it, folks, this week's Roundup. We look forward to seeing you next week for yet another great week in oncology.